Hello, welcome to Holistically Speaking. My name is Morella DeVoe, and our show today is with a very special guest. Dr. Erin Sepic is joining us tonight, and she's going to be leading us through a show that we've titled A Unique Approach to Natural Medicine. We're going to be talking about how you might want to think about visiting a chiropractor, Dr. Erin, or another chiropractor, but particularly today, she's going to be talking about how she can help. She's worked with a lot of people, helping them with conditions other than what you might typically think visiting a chiropractor for. Before we jump into the show, I want to invite you all to email us. If you have any questions, if you like the show, share your comments with us. Or suggest topics for the show, things that you would like to have us talk about. And you can email us at holisticspeak@gmail.com. So welcome, Dr. Erin. As I said, you are a doctor in chiropractic. You're also an applied kinesiologist. But I know you have a whole bag of tricks that you use for a variety of conditions that I would love for our viewers to learn about. So tell us a little bit about your practice and the different things that you practice.
Absolutely. Thank you so much for having me. Yeah, my practice is a little bit of a fun bag. I love that my work is really mostly play. I do chiropractic, which is a modality really around joint mobility and alignment, which reduces nervous system interference. But there's a lot of that out there, and it's a fabulously safe, easy, effective tool. But I also studied in applied kinesiology before I left graduate school, and that gave me a ton of other tools, which I really felt like I wanted. I wanted more things to play with. Mm-hmm. And so in my practice, I do a lot of applied kinesiology, which is really more about movement analysis, a lot of gait stuff, a lot of orthopedic muscle tests around all the joints that I'm looking at chiropractically. Mm-hmm. A lot of myofascial techniques. I do a ton of muscle work and fascial work, and that's how the cranial work ended up sort of coming into play in my practice through AK. I also do a ton of ergonomic assessment, depending on what the strain is, whether you're laying brick or roof, or you're nursing 2 twins and raising 3 kids. There's very different ergonomic loads there, but that's all incredibly important as to the program and the way that I'm going to address someone's case when they are coming to see me. If they leave me to go and do that, I need to know that, and I need to help them educate them as to what they can do to negate the effects of that sort of lifestyle ergonomic thing, and modify it as much as they can, and then negate the effects of whatever's left over. I do a lot of exercise therapy. I recommend a ton of different types of exercise and movement, and I do a lot of education around that, basic fitness, and a lot of nutrition, and I do some breath work. And more recently, I've gotten into more energy and intuitive work too, which is sort of in the mix, but you meet people where they're at. And if an engineer comes in and he's got a foot problem, I fix his foot problem. Right. And we'll work wherever that is. But if people need more support, or if they're in the middle of some sort of crisis, then there's a different type of co-treatment and a different mix of the stew that we both handle. Yeah.
So chiropractic, applied kinesiology.
Sacral,
ergonomics, myofascial, exercise, breath work. I mean, these are all very varied tools. And you also do craniosacral as well.
I do.
So I would love, because you have a couple great stories, just personal stories that I know because you're my friend. And I think I would love for you to share those stories, because it would help our viewers to start getting a flavor of how these techniques can help a variety of conditions that we might not typically think about visiting a chiropractor for. Right. So the first story is how you got into chiropractic.
Indeed.
So can you tell us about that?
Yes, I always knew I wanted to be a doctor, and I wanted to help people, and I couldn't seem to keep my hands off people. I just naturally, in high school, would just go, and I had a bunch of athlete friends of mine, and we'd just work on each other in the cafeteria. And it just seemed so natural. I was always fascinated with anatomy and how things worked. And I got in a car accident when I was in grade 10 with my dad, and my dad took me in to see his chiropractor. And this guy was just the happiest dude I'd ever met. And he was a blast, brilliant triathlete, practice manager and just loved his job so much more than any other type of doctor I'd ever seen. And every time he left for a race across the world, whoever covered his practice was, while less manic, similarly satisfied and content and happy. And I was just like, this seems like a good fit. So I decided to become a chiropractor, and I remember really being sold on it when I was in college, and I didn't have any health insurance when I was first at UVM, or I didn't know I did. And I was training on the track team, and I had a bad throw in January, and I released it was my first time throwing a 35-pound weight, which is the indoor hammer throw. And I felt something crunch right between my shoulder blades, and I couldn't really walk. I couldn't turn my head or my shoulders anyway, and I thought, man, I have to go see a chiropractor. I'd been trying to, but I didn't have any money. I was on scholarship, but I couldn't work because I was a foreign student. So I was just sort of like, okay, I guess I can't see a chiropractor. And then I went, and he got me fixed up right away. And I found out I did have health insurance, so I had access to that care, which is really important for athletes who are lifting heavy things.
So you kept going.
So I kept going, and then that was January, and then April, I realized, I had strep throat 3 times that fall. I had the flu, despite the mandatory flu shot for all the scholarship athletes. I was really sick that fall. I did fine, but I was constantly battling something, and I didn't understand why. And then it was January I started seeing him. And April, when everybody's gone and everybody but the baseball team and the track team is like stuck at UVM, everyone else has gone home. And it wasn't really until then that I realized that I hadn't had a sniffle since January. And I spent the next 2 weeks while we were stranded there waiting for ECACs trying to figure out what else in my life was different. But the first year pre-med, nothing was different.
Right.
Like I couldn't figure out anything else, and I realized that it was the care.
That you were going to chiropractic now.
I was, wait a second, I'm getting adjusted regularly, and my immune system, I mean, to have that massive a shift with while eating the same food, going to the same classes, the same chem lab, same training partners, same travel schedule, like nothing else was different, same dining room food, like, and that's when it really occurred to me. I'm like, wait a second, there's something far more important going on here. And your immune system, like every other system in your body, is mediated and modulated by your nervous system.
By your nervous system. So you went through the flu season and you didn't get sick. Your immune system was all of a sudden radically different because you were
so much stronger
doing chiropractic.
And it just, that really, I was like, no, I'm not doing anything else. I'm going. So
this is perfect because people watching the show who might have thought of a chiropractor as like, oh, my back's out.
Back, right.
Well, actually, if you constantly get the flu, you actually could do really well with chiropractic care.
If your kids are sick all the time,
Yeah.
They get better
The
faster,
kids are sick all the
and
time.
they get sick less
Yeah.
when
And
they're
we'll
getting
get into
regularly
more of
adjusted.
those. Yeah.
Mm-hmm.
And we'll get into more of those health conditions in a minute. The other story that I love is the story, because it helps to illustrate how all of these tools and techniques
Right.
that you use can come together, and I know you work with other practitioners as well, is the story of when you broke your foot. Can you tell us?
Yes, I broke my foot badly about 3 years ago. So I was pretty, I was 6 years into practice at that point, and I kind of, sort of feel like I've been baptized efficiently at that point, effectively, and I was playing volleyball. Luckily, my mom had come to visit me that night, and she hadn't seen me play since high school, so I was all excited. I think I got a little too excited. But I came down from a block and with my foot fully plantar flexed, and I went over a really hard inversion sprain. Like everyone heard it explode. I dropped like a ton of bricks and was like, that could be broken. But I really heard it regardless. I knew I was out for the season. It was minute 1 of the first game of the first night. I was a little put out. But I packed it nice, and Mom, luckily, she was there to drive me home, or I would have been stranded. And I iced it. When I got home, I took a bunch of nutritional supplements for inflammation, and I took a bunch of homeopathic remedies for trauma, and went to bed just praying that it wouldn't be too bad in the morning. I sent some emails out to some friends. I knew I would need care the next day, that whole wounded healer complex. But Mom drove me first thing in the morning to see a colleague of mine, Dr. Bill Schenk in Williston at Missouri Health Center, and he, in about 10 minutes, he did a bunch of, he's also an applied kinesiologist, and I wanted somebody who did that stuff. And there's a few of us in this area, which is great. And he did some AK, it was just gentle, really effective, and he took some films for me, so I got the x-ray because I knew I'd need to look at it. And we looked at it together, but we both decided that we should probably get a radiologist to look at it. And I left there, he knocked 40% off my pain index in 10 minutes. Yeah. And Mom then drove me in, I think I got my crutches, and then I went straight to see another colleague of mine who's an acupuncturist and herbalist, Charles Murdoch, who's on Tilley Drive. And he needled me. He doesn't normally needle me. He practices something called Toyohari, which is a little less aggressive, but it was pretty clearly an issue.
He did acupuncture.
He did acupuncture on me, and he told me to stop icing. He gave me an herbal poultice, and I agreed. Probably knocked another 30% off the pain index. And before I left there, in a normal hour treatment that normally would cost you, what, $70, 75, something like that.
Right.
And I left there thinking, man, this isn't so bad, And then I got home, and my friend Karen Kennedy, who's a craniosacral goddess and also a physical therapist, we have traded here and there, and we'd arranged a trade. So I worked on her, and then she worked on me, and right near the end of her treatment, she was so gentle in that typical cranial way. But I'd never had cranial work while on something acute before. I'd been receiving it for years from different people, but right at the end, it was just like that little knot of pain and pressure just completely deflated. And I suddenly, like the little, the thing that you hit at the fair that hits the bell.
Right.
It was just, I was 100% pain-free. And that was noon. That was 17 hours after I broke my foot.
Yeah. That's what's so powerful about that story is that
Right.
within 24 hours of a fracture,
Right, serious trauma.
you saw a chiropractor,
chiropractor,
an acupuncturist, a
kinesiologist.
kinesiologist, a craniosacral practitioner, and
I was good.
you were 100% pain-free, and they helped you heal. So-
Utterly. I mean, I was completely comfortable. I still had a broken foot. I wasn't going running, but I was happy. I was able to work. I made a little scooter out of one of my office stools, and one of my radiologist patients stopped by on her way back from the hospital to read the film to make sure that indeed, I'm like, yeah, I did. Okay, yeah, that's what I broke. All right. And it was wonderful just to have that kind of support and to know all the people that I know and to have my job and just, it was a fabulous experience.
So I really wanted to ask you for my own benefit, for clarity, but I know also for our viewers' benefit. When you have techniques and tools like, say, craniosacral, how is craniosacral different than what you would do as a traditional chiropractor?
I mean, anatomy would be one thing. Craniosacral, well, it sort of originated around the rhythm that, it is all about the rhythm that the cranium and the pelvis have together, which is its own rhythm. It's very different from the respiratory rhythm because these bones actually move when you breathe a little bit, but they actually have their own rhythm entirely separate from anything vascular or anything respiratory. And it was designed by an osteopath, developed. And it's a fantastically gentle technique. But as a chiropractor, for instance, like for ear issues, chiropractic can be really, really helpful for that at a bunch of different ages because there's a lot of the, let's see, I can't remember which division of the trigeminal nerve that is responsible for the muscle that comes into the inside of your middle ear canal, especially for little kids. And that nerve that muscle is innervated by the trigeminal, which comes out of your neck, this part of it. So depending on if the ear canal is sitting like this, it really doesn't drain that well. But chiropractic adjustments can help with ear infections because of the direct anatomic neurologic relationship. There's no woo-woo about this. Whereas cranial, not being woo-woo, it actually can address the set of the cranial bones themselves. So both of them, having both of those tools at my disposal is incredibly valuable when dealing either with adults with vertigo, Meniere's disease, obviously earaches and hearing dysfunction, assuming not from too many concerts in their 20s, but there's all sorts of different adult conditions that can really be helped doing cranial and very subtle myofascial work around the ears and in TMJ as well. And then chiropractic for helping everything neurologically, but also with lymph, also clearing the lymph channels and letting your whole head drain appropriately. And throw in some essential oils and some homeopathy, and it's like, you have a pretty great cocktail.
Right. So this is wonderful because what I get from you is that you might do traditional chiropractic adjustments, but then you do the very gentle craniosacral kind of cradling, holding, very gentle manipulation. Then you work with muscle movement as well and kinesiology and exercise and all of that. And so here you're telling us about ear conditions. What are some other conditions or health issues that are not the typical, I need my neck and back cracked by a chiropractor that people might be suffering from and could greatly benefit? What are some of the things that you treat?
I'm just thinking, just the sweeping head to toe. Headaches are something that are pretty long time now I've been treated by chiropractors, but only fairly recently in the last decade have been insurance approved. But that, as well as a lot of those balance issues, clearly the neck stuff, but out-of-box stuff being more frozen shoulder stuff, imbrication, even bursitis can do well, although I almost always co-treat with a physical therapist for that. Elbow issues, I do a lot of carpal tunnel and wrist issues, personally, because I'm a prenatal and a pediatric specialist. There's a lot of postnatal wrist strain on a lot of mothers. Interestingly enough, constipation is one thing you wouldn't think of. You know, a lot of my parents call me Dr. Poop, the poop doctor. You know, if their child hasn't had a bowel movement and I don't know how long, they bring in, you know, and I don't ever fail. I mean, it's never longer than 15 minutes. It usually happens during the visit, like in the diaper, and it's like, it's a blast, but it's really important. Like that movement in your viscera is instructed by your nervous system, and it's really, and when you, especially if a child is learning how to walk, they'll do a lot of imbricating of their sacrum as they fall, and that really creates a lot of pressure on all that nervous structure coming through there, and often a simple sacral hold will just loosen them right up, and they're just like, oh, thank you, you know, and now we can all sleep at night. So constipation wouldn't want to be one of those things that you're like, I will go see a chiropractor. So a lot of indigestion. I do a lot of stuff with bowel and a lot of nutritional issues around that, and a lot of co-treatment with that as well. And the more inflammation, the more likely I am to pull in an acupuncturist and whatnot. But a lot of hip things, a lot of people don't think about hips, but because it's close to the pelvis, they might end up in a chiropractor's office.
Right.
I do a lot of work with knees and a lot of work with feet, a lot of work with running technique and walking and gait analysis, and so we end up with what plantar fasciitis would be the farthest thing down there.
So what I hear you say, obviously from head to toe, almost anything can be improved with chiropractic and craniosacral care, because there isn't a part of your body that's not directed or connected to your nervous system. Yeah,
and those I think are part of the reasons that every now and then, every blue moon, you'll hear somebody talking about how chiropractic is, you know, angelic or came straight from God. And those are people, when you think about, if your nervous system is optimized, if you have the least interferences you can manage, then everything's going to be working the best it can. And then when you turn around and you get your joints taken care of as well on top of that, the ones that aren't guiding necessarily the spine, those are the same, you know, it's the same type of optimal motion. And then on top of that, when you have, when you add the cranial, it's a pretty fantastic little bag.
So I'm picturing you working with, obviously, as you've mentioned, people of all ages, from infants to, you know, elderly.
Later-term geriatrics, yes.
Yes. And I would imagine, I'm picturing you like cradling babies, maybe doing more of the craniosacral, really gentle technique. So tell us some of your favorite success stories with maybe your younger patients, and then your younger ones.
My wee ones, often that whole history will happen sort of before I touch the child, and I get to observe where they're at, you know, energetically, physiologically, and I'm looking at different postural cues, depending how little they are. Often if they're tired, I usually will let them sleep. Like if they have been sleeping, we don't wake them. And if we can get them out of their child seat without waking them, then that's just fabulous. And I can actually teach the parents how to gauge the range of motion while they're sleeping without actually waking them up, just looking at their body language and their expressions when they're gone. And then we make an adjustment. Oh, they didn't want to turn their head to the left. Like, are they nursing off the right breast? Like, oh, actually no. And I'm like, okay, well, this explains that. And then we make a little adjustment that doesn't look like anything frightening at all, but then we do it again and the child's fine, and the parents are like, what, you know, how? And I show them skin fold analysis and how they can see, you know, does your child, are they pooping regularly? Because this is one of the things that you can check, and if that is a red flag, then bring them in here, you know.
Right.
So it's wonderful, and probably one of my favorite things to do with babies, or the most professionally fulfilled that I feel with the wee ones, is when there's something really wrong, when you have a colicky baby. There's nothing fun about that. It's awful. And sometimes people will, you know, they'll be at it a week or a month or two before they end up in my office because some midwife or, you know, La Leche League compatriot had sent them in here. A lot of lactation consultants will refer people in. And the child is, you know, really, really uncomfortable and unhappy, and I put my hands on them and do a little bit of traction in that sacral hold. And often there's a diaphragm issue as well, which can come slightly from mom's diet. So we do it like a fully holistic, like, okay, what are you eating? What's your blood type, and how does this work? but almost immediately the child will begin to relax, almost immediately. And if they're really tired, if they haven't been able to sleep, as I'm adjusting them, they will fall asleep, or they will want to nurse. And then I keep adjusting them while they're nursing. And then when we're done, poof, they're out. And I always tell the parents, don't worry about this. They may nap for a long time. I know it's uncharacteristic. You know, if you need to, check a couple of vitals, but I know that they're going to be fine. You know, give me a call. And we put them back in their seat. They're still sleeping, like mom's crying with relief, and like everybody's leaving. She pays my office manager, and they're just like, I'm like, it's okay. It's
well,
okay.
this is
see
incredible what you're sharing, because I have had friends who pretty much resign themselves. I have had a friend say to me, I just have accepted that I have a fussy baby. And, you know, it's very draining on the parents.
So draining.
But I'm hearing you say colic, sleep issues, nursing issues, digestive issues, you know, infant constipation, all of these things, you're obviously helping them with very simple, gentle adjustments where the babies are sleeping in your hands. So
it's the easiest, it's the most magical, fun part of my job, probably. Adults are fun, and it's fun to help athletes perform better, and I see a lot of athletes, but there's, you know, just that glow that people get when you're like, their child is doing so much better, and everybody can sleep and wake up and like live life normally again. It's much more rewarding, I find. Yeah.
So I want I want to change
gears
a little bit, because you're an athlete, and you've mentioned athletes several times, that you work with athletes. So what's one of the typical athletic conditions that maybe you can help our viewers with, of what experience you've had?
I do a lot of exercise prescription with people, depending what their sport is or what they're doing in the weight room and whatnot, and what condition they're coming in with. I'll always ask specific related questions to those things to make sure they're not doing anything to shoot themselves in the foot while we're not working together, and maybe make some modifications in the weight room and whatnot. But probably, you know, in Vermont, especially in the spring, right around now, probably the thing that people are doing the most that they haven't been doing for the last 6 months or so is running. We're about to have the VCM, are we? Soon. Plantar fasciitis is one of the most common injuries, I think, and it's one of the most like, gotta rest it, or gotta work it out, or gotta roll on the tennis ball or golf ball or whatever. But it's one of the easiest things to treat, and 60% of the treatment is for the patient to do. Really, what plantar fasciitis is a straining, a length straining of the plantar fascia, and it's often engendered. There are 3 different things that can contribute. One of them is biochemical, which is the least common. One of them is structural. Does your foot have enough support? Are you in the right footwear? And the third one is myofascial, which is largely the most responsible part. And usually what's happening is that the gastrocsoleus, so the calf complex of muscles, are too tight. And this athlete, most runners don't stretch enough.
So the calves are tight.
The calves are super tight. And if you think about, if this is your calf and this is your foot, your heel is the joint between them, that lever in between. And this muscle group is so much stronger that it's going to win. And it actually shifts your heel slightly posterior. And it's slight enough to not, like, obviously show up on x-ray. And this isn't like a normal mainstream medicine type of diagnosis. But what happens is it strains the plantar fascia, and it puts it under so much more of a load, and it really, really suffers. So stretching out the calves, keeping them flush, learning how to keep them loose, and then doing a little self-adjusting after you do that, especially after you run, or if you spend an afternoon on a ladder cleaning windows, you know, you got to do that same sort of protocol, and it's usually incredibly easy. It's like a 2-visit thing.
A 2-visit thing. Because I fortunately have never had this, but I hear so many people complaining of plantar fasciitis, and here you're saying you in 2 visits.
It's usually not a big deal at all. The only times that it takes a bit longer than that, probably the longest case I ever treated was, there was a bunch of confounding factors there, but this woman actually had developed pretty good heel spurs, so we had to put her on some serious fish oils. And her heel spurs didn't go away. If we'd taken the x-ray again, I bet you they'd still be there, but the pain was gone in 2 months.
The pain was gone.
And she insisted on wearing the shoes that she wanted to wear, which, you know, is everything sort of factors in, but in 2 months she got rid of a 3-year condition.
Another condition that you mentioned a little while ago that people seem to suffer a lot from lately, and I hear more and more often they're going for surgery for it, or they get surgery for it, is carpal tunnel. And so what are some of the things that you do for carpal tunnel, and how does craniosacral or chiropractic help? More often,
definitely some adjusting, but often it's more that I apply sort of the applied kinesiologic principles. Often what happens, and one of my good friends actually is one of the best carpal tunnel surgeons surgeons around, and he's fabulous, and I've referred to him the 2 times that I've ever had a patient get this surgery. But what I do is I end up facilitating the muscle group that actually holds the carpal tunnel arch open.
Gotcha.
And I teach patients how not to fatigue it, because they need to. It's usually people who pronate chronically all day.
So you tell them.
So understanding, if you're walking around holding a dumbbell here all day, eventually that bicep is going to get really tired and sort of flip you off and is not going to hold that up.
Right.
And then you end up with clinical neurologic signs of carpal tunnel, but it's really a structural issue. It's not always surgical. And in 9 years, I've only had 2 patients have the surgery.
Oh, wow, that's
and one of them was totally fine for 3 years. Motor function and pain, she was fine. And then eventually she had some atrophy, so I sent her right to see Dr. Frenzen. So simple stuff. It's often more simple.
Yeah, well, we could keep going on so many other things, but we're running out of time. So can you walk us through the resources that you have for our viewers? And we have about a couple minutes for this. So
Perfect. Yes, so my website is synergichealth.com, and I've got a bunch of links on there upcoming, and that just sort of tells my story of the things that I do and the places that I was certified. So if you're watching this from nowhere near Vermont and want to find someone with a similar skill set, some of these websites are how you can do that. As far as educating yourself from home, a lot of the latest food research and supplemental research stuff, and how to cook your food or how not to cook your food. Dr. Mercola does a great job. He's a DO, an osteopath, and his website is, I think, probably the heaviest hitting natural website on the internet. Tons of information there. The International Chiropractic Pediatric Association is how I got certified in the Webster technique and where I learned all my pediatric work. So if you're looking for someone to assess your children and or babies and or bellies, that's a great place that you can find a practitioner from. The International College of Applied Kinesiology is where I was certified in AK, and they are worldwide. That is the US link, but you can find them straight through Google to find a practitioner who does all this fun, weird stuff.
Wonderful. Well, thank you so much for joining us. We have about a minute left, so I'm wondering if you have a little conclusion or punchline for our viewers in terms of the work you do.
Absolutely. I think the bottom line really is that I don't think most of us really understand how high it's possible to function health-wise. And that, it was a reminder when I broke my foot, like it can be way better than you think. And if you're somebody who's been struggling with a chronic issue, or if you have an acute issue that you're really looking for more feedback on, keep looking. A lot of folks think they've looked everywhere, tried everything. Given the amount of information that's out there, that is unlikely that you've tried everything, because you probably haven't come across everything yet.
Right.
Keep your chin up, keep looking, keep plugging, because the potential is unlimited in the human body of what it can heal from.
Absolutely. The body does heal itself, and thank you so much for sharing with us all of these conditions that a lot of people feel pretty stuck in, and how much you can help them. And thank you so much for joining us tonight. Again, if you have any questions or feedback, or just to tell us that you enjoyed the show, please email us at holisticspeak@gmail.com. Thank you.
Thanks, Marla.